Welcome back, guys. I hope you are all doing well. Today's my topic of discussion is about the second pathway of the basal ganglia, which is indirect pathway of the basal ganglia. Okay, guys. First I draw the structure related to the basal ganglia and participate in the indirect pathway, which is the second pathway of the basal ganglia. I tell you the functions of it and the pathway, how it works, okay, and related clinical diseases, okay. When there is damage to this pathway, what are the diseases occurs in the patients. So first I draw the structures. This is cortex, okay, which controls the motor activity of our body. What is the areas of the brain? Primary motor cortex, motor association cortex, primary somatosensory cortex, all these three areas which I draw in black color, okay. These are all the motor association cortex. The second structure is caudate nucleus. The third one is putamen. This is the putamen, part of the basal ganglia. The next structure is, which consists of two parts, internus and external part. Globus pallidus internus and globus pallidus externus. Next structure which I participate in this pathway, indirect pathway. This structure is not participate in the direct pathway. Now today's topic is indirect pathway. So there is one more structure which is here, which is the subthalamus, okay. Subthalamus participate in indirect pathway of the basal ganglia. Subthalamus not involved in the direct pathway of the basal ganglia, okay. So the next structure is, which I draw here. This is similar thalamus. Here is two nuclei of the thalamus, ventrolateral nucleus and ventroanterior nucleus, okay guys. So first understand the function of this pathway. This is the direct pathway. In the previous video I explained the direct pathway. Now today's topic is indirect pathway. I draw the structures, okay. All these structures are involved, parts of the basal ganglia, and how the action potential and the function performed by these structures. So guys, first the axons travel towards the caudate nucleus, also the putamen, okay. These are glutaminergic axons, okay. Glutaminergic neurons which release the glutamate. Glutamate is a excitatory neurotransmitter, okay. It increases the action potential. Later I explain the action potential all. First I draw the structure, okay. So from caudate nucleus and from the putamen, the axon enter in the globus pallidus externus. This is globus pallidus externus, okay. In the direct pathway it enters in the globus pallidus internus, I discussed in previous video. In the indirect pathway it enters in the globus pallidus externus, then it goes towards the subthalamus, okay. From the subthalamus it again enters into the globus pallidus internus, okay. From the globus pallidus internus it goes towards the which part? Thalamus, ventrolateral and ventroanterior nucleus of the thalamus. From these two structures it again enter into the cortex, motor cortex of the brain. So this is all the pathway, Okay, now I show the how it controls the activity of the indirect pathway and what are the function of it. So first I tell you the function. Guys, the indirect pathway involves in the decreased motor activity. Okay, its function is decrease the motor activity. In this manner it prevent the unwanted movement, because for example I am sitting, okay, and I am not feeling like I am moves like a dance, I can do dance. Okay, if my mind is thinking I do dance, then I dance. Okay, if I my mind not thinking about the dance and I can do dance, so it means there is a there is any problem in this pathway. It's this pathway is inhibit the movements. Okay, direct pathway, which I discussed in previous video, increase the movement, increase the muscle activity, increase the motor activity. This pathway, this is indirect pathway. This pathway inhibit the motor activity, most important unwanted motor activity. Okay, so this is the function. So now I tell you the how action potential move to this pathway. Okay, so guys, the first neuron is glutaminergic neurons. Okay, the first part. Okay, it send the signal to the caudate nucleus and the putamen. So glutaminergic is excitatory neurotransmitter. It means it excite the caudate nucleus and putamen. Yes, so from the caudate nucleus and from the putamen, the action potential is very high. Okay, it moves, is very high, it moves towards the globus pallidus externus. Okay, so here what are the neurotransmitter release? Here is GABA. Okay, okay, GABA. GABA. GABA is a neurotransmitter which is released when there is a action potential is reached to the globus pallidus externus. So GABA is inhibitory neurotransmitter. Okay, so the action potential towards the subthalamic nuclei is decrease. Okay, is decrease. So it reached to the subthalamic nuclei. Now the subthalamic nuclei receive the action potential which is very low. It means there is a less stimulation. Okay, at the subthalamic nuclei. When there is less stimulation from the GABA receptor towards the subthalamic nuclei, it means there is a less inhibition of it. It means it more excite. Okay, so the subthalamic nuclei release, this is also glutaminergic neuron, so it also release glutamate. Okay, so action potential goes towards the globus pallidus internus is very high. Okay, from the globus pallidus internus, what are the neurotransmitter release by the action of the glutamate? A lot of glutamate goes to the globus pallidus internus, and from the globus pallidus internus the GABA receptor is released. GABA receptor is released, which is very high in amount. Okay, so the very high GABA is very high. It travels towards the thalamus. Okay, so now the action potential goes to the thalamus. So when there is a high amount of the GABA is there, it means it strongly inhibit the thalamus. Okay, it strongly inhibit the thalamus. So when there is inhibit the thalamus nuclei of the thalamus, ventrolateral and ventro-anterior nucleus, it means the action potential which goes to this area is very low. Okay, very low, not high. Okay, so at the end of it, when it reaches to the cortex again at the motor area, the action potential is very low. So when there is action potential is very low, the motor activity so when there is action potential reach to the cortex is very low, it means the motor activity also the motor activity also decrease, too much decrease. Okay, when there is a lot of action potential goes to this area, so it means a lot of inhibition. Okay, so one more time I explain you how what happens in the action potential of it. So first, there is a glutaminergic neuron. The first step, the glutaminergic, I have to draw in yellow. This is the first step. In parrot color I have drawn it. First step. Okay. When the action potential travel towards the caudate nucleus and putamen, it is excitatory. So excitatory action potential goes towards this area. Okay, the globus pallidus externus. So here GABA is released, and when GABA is released, it is an inhibitory neurotransmitter. This is the second step. Inhibitory neurotransmitter is released, GABA. GABA send the signal which inhibits the neuron. Okay, the other neuron is inhibit. So when there is inhibition of the neuron, there is less when there is more inhibition of the neuron. Okay, when GABA is there, inhibition of the neuron, it means that the neurons are release the chemical which is more active. Okay, when there is a less inhibition, less GABA is there, it means more active. Okay, so there is number 3 step, there is a lot of activation of the glutamate. Okay, at the subthalamus, and when the action potential goes towards the globus pallidus internus, okay, it is high. Okay, so here is again release GABA. GABA is neurotransmitter inhibition. Okay, so the inhibitory signal goes to the thalamus. So when there is a lot of GABA, the more inhibition takes place. Okay, so when there is a lot of inhibitory takes place towards the thalamus, the ventrolateral and ventroanterior nucleus, so the action potential from the thalamus towards the cortex is very low because it inhibit through GABA. So very less action potential is go towards the cortex. Okay, so when there is less potential goes to the cortex, there is a less motor activity, so motor activity decrease. Okay, so guys, this is the indirect pathway. In previous video I explained the direct pathway, in this video I explained the indirect pathway. Just remember the one structure of the indirect pathway, which is subthalamus. Okay, which is what structure? Subthalamus is involved in indirect pathway. Okay guys, so this is the pathway. Okay, how the basal ganglia control the motor activity, decrease the motor activity by indirect pathway. So guys, must remember these pathway. Okay, so now I tell you the most important point, okay, which is the clinical importance related to indirect pathway. Okay guys, this inhibition of the motor activity, decrease in the motor activity, the exact function is decrease the motor activity, unwanted motor activity decrease. Okay, which my body does not want. If this pathway is damaged, when there is damage to this pathway, okay, this pathway is damaged, what happens? The motor activity which I not wanted, which I not need, I can do. Like I can sit and I can start dancing. Unwanted movement, my body does not want it, I also does not want it. But if there is a damage to this area, the body can do dancing movements and other like unusual movements, unwanted movements, which I did not need. So what are the diseases name related to these conditions? So I erase a little bit. Okay, what are the disease process which is the most important? Okay guys, what is clinical? So the first disease, what are the disease process which is related to it? Guys, the first disease is Huntington's disease. What is the disease name? Huntington disease. The second disease is rheumatic fever. Guys, remember the rheumatic fever, there is a Sydenham's chorea, which is like a dancing movements, which the body not need that movement. In rheumatic fever, there is a damage to the basal ganglia, and there is a unwanted movements of our body like a dance. The name is Sydenham's chorea. Okay, in the rheumatic fever. So the third disease First disease is Huntington's disease, second disease is rheumatic fever, and the third disease related to the pathology, any pathology related to the damage to the brain. Okay, so any pathology related to the damage to the brain, maybe any trauma related to the damage to the brain, and there is unwanted movements. Okay, so guys, remember the three diseases. What's the name of three diseases? The first one is Huntington's disease. Huntington's disease. Second one is rheumatic fever. Okay, Sydenham's chorea. And the third disease is, what's the name of the third disease? Third disease related to any trauma to the brain, and there is an unwanted movement of the of our body. So guys, I hope you understand my video. Please like, share and subscribe it, and press the bell icon to receive any new video. And please made the notes in previous video the direct pathway, and in this video indirect pathway. In next video I explain you the third pathway of the basal ganglia, which modulate the activity, both direct and indirect pathway. Okay, very special type of pathway, the third pathway. So guys, please like, share and subscribe. So guys, be happy, take care.